Preterm birth is the biggest killer of children under 5 worldwide. It's devastating, it's on the rise, and until recently we haven't been able to safely reduce preterm birth rates in the Northern Territory, particularly in the top end, where we see devastating rates and sometimes rates that are highest when compared to the rest of the world. So essentially what we're aiming to do is design a pregnancy education tool that's centred around women, what they want to know, how they want to know it, to empower them to be really involved in their maternity care, to make them feel like they're part of the decision making, to ensure they're engaging with antenatal care effectively, with the big dream of reducing poor perinatal outcomes across the board. When we had yarns with women, actually they said to us, well, when I show up for my care, I don't know what questions are going to be asked of me, and I don't know what questions I'm supposed to be asking. I come into this doctor's office, I've never met the doctor before, they explode with all this medical jargon and information at me that I just am really having difficulty following and understanding at times. But if I already had that at my fingertips, in my language, in a way that I'm going to receive it, then I'm prepared for those conversations and I can make better decisions about my health. The evidence is clear. When health services are evidence-based, but culturally safe and relevant to the community, you just get better health outcomes. This co-design part of our project is vital. Going out and having these beautiful yarning circles with women in the community, they're co-designing with us how they want to receive the information.
They started to tell us, I use my phone. I was using Dr. Google. I was using this pregnancy app to tell me how big my baby was, but it told me my baby was as big as an aubergine, and I don't know what an aubergine is actually. Women were very hungry for more education and education that they could access digitally, no matter where they live in the top end. And the women wanted to be involved. They want to co-design their education.
We're going to take women on the journey of their pregnancy. Instead of them seeing my baby's the size of an aubergine, they'll see my baby's the size of a Kakadu plum, and they can recognise what that means immediately. We're going to talk about things and present ideas to them, how they might be looking after themselves and what type of things they should be learning and doing. Aspects of your pregnancy that the healthcare providers are going to talk to you about, tests and ultrasounds, presenting those health decisions and procedures in a way that's relevant to them, whether it be consenting someone for a cesarean section or offering them a screening tool that they might not know what to do with the results. There's no healthcare provider that I know that isn't doing their best. But actually, what's available to us in terms of resources, language, education, it is limited. We want to broaden the way that we interact with people so that their healthcare is safer.
So all of our co-design yarning groups actually could have gone for double the time we scheduled them. They're so generous in sharing their stories when they are in a safe space, what their pregnancy journey was like and what they want from this brand new co-designed pregnancy app.
The research impact is going to be huge in terms of what it does for our community. But the challenge initially is going to be in its spread. There are so many other remote communities around the top end with their own language and culture that we want to be part of this project as well. And in the initial stages, we may not have the resources for that, but what we'll be able to do into the future is limitless.
Women say they want to be involved in co-designing new pregnancy education. Well, when you can make that happen for them, there's no feeling like it really, is there?
Our team at Menzies had been trying for a couple of years to get funding, and I remember receiving the phone call to say, Avanta backing you, and it was just pure joy and relief. I know that this is going to improve clinical care. I know that this is a major step in culturally safe, woman-centred, trusting care relationships between some of the most vulnerable women in the country and the health systems and the health care that's available to them.